I'm seeing somebody asking question MLS students. I am still to prepare something for MLS students. I've not started with MLS students, so those MLS students, I have not prepared something for you guys yet, but I will do that anytime soon when I'm done with the nurses. If you can wait, okay. If you will not be able to wait, then you only wait and then maybe get to other groups, maybe get to some lecturers who can revise, we can get questions. But staying here is beneficial for you because it will help you in that you can learn some basic things and you can learn how to tackle even questions of MLS students. So, but if you wish to leave the group, it's okay. So we are saying question 19, the most common sign of vaginal candida is cheesy vaginal discharge, foul smelling vaginal discharge, fishy odor, none of the above. Take note, the action is vaginal candida, that's a fungi, right? Candida is fungi of the vagina, and so most often at time the discharge that comes out during that process it is always odorless. I remember when I think I was in 2015 and that was something of that sort. We were doing a research on various vaginal odors, and we noticed that that research made us to understand that when a lady has fungi of the vagina, it could be yeast cell and all of that, it's always odorless. It doesn't have odor. There's no odor that you get from that. So any answer among these that have odor in it is removed from it. Then cheesy vaginal discharge is where my target is. I'm looking at the answer and then like cheese, I don't know how to describe that you guys can understand. Cheesy vaginal discharge. It's really, some of you may understand what cream white mean, right? Something like it occur in parts. Like when you fry egg, you don't fry it well. Like when you are not able to fry it well for it to come around on the plate, it separates. Those of you who may have fried the country egg, it's something of that sort. It comes out like that, like in small grace, something of that sort. So take note of that. So most often at times, such vaginal, if you see a lady who has a fungal infection, like a yeast infection that is accompanied with odor, she has a bacterial infection that has accompanied that. It's not like you have every fungal infection of the vagina at times does not come with odor. If it's only the vaginal, if it's only the fungal alone, candida, you will not find odor in it. Take note of that. Question 20. During renal evaluation, the nurse discovers the patient has blood in urine. What does this mean? What is this called? Dysuria means painful urination, right? And urea, what does that mean? And urea, hematuria, oliguria. Oliguria simply means you go to urinate, you actually feel the urge to urinate much. You go to urinate, you urinate really small. So you know that hematuria is the right answer, right? Hematuria, blood in urine. This indicates, question 21, this indicates a delay in voiding due to response to mental command. A delay in voiding, therefore in urination, due to a response to mental command. What does that mean? Hesitancy. That's the real name. Frequent urgency. Urgency is the urge to urinate immediately. You just feel like if you don't urinate immediately, you pee on your body. That's what urgency is. Then hesitancy is you actually go to urinate, you feel the urge, you go to urinate, you are getting sparses of urine coming out in bits. Most people who experience hesitancy, they suffer from what is known as oliguria. Then frequency, most often at time pregnant women they have when they're pregnant, you see them experience frequent urination in that any urine, especially those who are on the third trimester of pregnancy, any urine that they go, they just carry, you see them, they just go and urinate. Anything that drops in their bladder just goes to urinate. The most definitive test for diagnosis of benign prostate hyperplasia is digital rectal examination, PSA. Question 22. Digital rectal examination, PSA, serum creatinine. They are asking us if A and B are correct. Now, the reason why you will notice that I will prefer digital rectal examination because that is the only way manually you can, like, most doctors try to, like, to examine the prostate, right? Digital rectal, by seeing the finger in through the anus, when they send it in for the male, they can get it. So when you see things like benign, when you see things like benign prostate hyperplasia, they're talking about growth at the level of the prostate, right? And so they're asking us, is A and B? If A and B are correct, the right answer is, that is what that the full meaning of that PSA. My God, I will look for that answer. I will look for PSL and then GERD. I'm sent here. But the right answer to that question is digital rectal examination. That's the right answer. Prolonged erection without sexual excitement in men is known as, prolonged erection without any sexual excitement in men is known as impotence, epispasia, priapism, hypospadia. Is now you notice that priapism. I would prefer priapism is the right answer to that. That's why at times most people at times when they get into this condition, it's a medical condition where a man can, have you ever heard where most of these some particular professions, right? Like this military, they sleep with women and they don't get satisfied until the women they cry, 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 and all of that. They see them having issues with their private part, they have bruises and all of that. It's because of this condition, priapism. They can stay for longer than normal. The penis continues to be erect, but they don't get sexual satisfaction. And because of that, it stays for long. And so the only thing it's just for them to go for pathological, or it could be a pathological condition. It could be handled pathologically and as well as mentally, right? Because at times the rough treatment training that they been expose them to, it exposes them to such conditions. So most of the time, people who rape children, they have this condition, priapism, because even after they rape the people, they don't get satisfaction. Though most of them may get satisfaction, but in 90 cases, 90% of such cases, they don't always get satisfied because of what, priapism, prolonged erection without sexual satisfaction. Which of the following statements is or are associated with tetralogy of Fallon? Tetralogy of Fallon is a congenital condition that affects little children. The children are delivered with four congenital diseases. It occurs in the heart. Four congenital disorder. That's why we say tetralogy of Fallon. Tetralogy of Fallon is a very good pathology, especially when you guys will be doing pathology of the cardiovascular system. You will see that it's principal. I remember this particular year, they asked us that year, they asked students to define, they were to give some short notes on tetralogy of Fallon. I remember, surely it should be the old program. The question should be in the old program. Ask them to define it. So now, what are we therefore saying? We are saying that the answer A, right and left ventricular shunt is correct because now the ventricles become enlarged. A thick right artery, a thick right artery is correct. An iota with a shifted orientation is correct. Why is it so? The iota, it has a hole. Most of the time, it doesn't end at the level of the hole. The hole, there's a hole also that is formed at the level of the atrias. We call that patent ductus arteriosus. Patent foramen ovale, sorry. Patent foramen ovale. You find it. So now, in a case where a child is delivered with four congenital conditions in the heart is enlarged, the right heart of part of the heart is enlarged because normally at times it is expected that the most muscular part of the heart should be the left side of the heart because the left side of the heart that does the greater work than the right side of the heart. So that instead, when the right side of the heart also has an issue, it's a problem. And when the muscular nature of both the left and the right side of the heart they are equal, it's a problem also, right? Or when the orientation of the aorta is distorted, when the aorta is not pointing in the direction that it's supposed to point in, it's a problem. So all of the above is the right answer to that question. An infant suffering from diarrhea is likely to experience, they say, deficit in fluid volume, fluid overload, increase in electrolytes, and smoke skin. Take note, during diarrhea, a person loses water, person loses ions. That's the first thing you should understand about diarrhea. So most of the time when you are handling or treating people from diarrhea, you should have mastery. You should know that this person has lost water, this person has lost iron. So what can I do to replenish the iron that the person has lost? What can I do to replenish the water the person has lost? So people or children who suffer from diarrhea, they also suffer from deficit in fluid volume. That is the truth you should understand. They suffer from deficit in fluid volume. An example, right? Deficit in fluid volume. You see them have sunken eyes, right? So that is an example. And then that's why then you see there's a solution called ORS. It's made up of salt. There's a traditional way of doing it. They put 2 teaspoons salt, 8 cubes of sugar, all of that is just to replace the ions that we have. So we are done with the MCQ of case study 2020. So let's go to the structural section B. Any questions so far? Or is it that we are understanding sharp?